you do anything for a surgical scar? I had a nose job with lip lift, but there's a scar. I tried laser. Yeah, do stuff for surgical scars for sure. The question is always, if someone says I'm not happy with my scar and they want something done about it, the question is always, what's the problem with your scar? And we kind of really are looking for an answer to that, rather than, well, I've got a scar and I don't like it. Because if you've got a scar and I don't like it, a surgeon can't really remove that scar for you. They can only change the scar. So there kind of has to be an aspect of the scar that you don't like in order for us to see if there's something we can do about it. So if it's just the fact that there's a scar there, difficult. If it's dented in, lumpy, in a bad line, it probably won't be in a bad line. So I'm guessing it's sort of at the sort of junction between your nose and your lip. So that's more for traumatic scars on the face if they're in a bad line. So if it's dented or lumpy or red, I mean, laser can help with red ones. There are things to do. Certainly, if redness is a problem, massage and moisturize is the main thing. Lumpy scars, silicone, steroid injections can be considered. And then dented in or scars in bad, unfavorable lines could consider surgical revision. But I'll tell you now, lots of people say they want removal, really, scar removal, but not many people actually get it done because we're limited as to what we can do. So there are things we can do to try and improve scars. We can't get rid of scars. We can try and improve it. If you've had a lip lift and a nose job, I'm thinking a plastic surgeon did it. So you've got a scar which is given to you by a plastic surgeon. So even less options for improving. And the first thing I would say is you've got to wait about a year really to give it a chance to settle, because it might settle. But yeah, so time is probably the most important thing. Moisturize and massage, and then looking if you've got one of those specific issues that might be able to help with. But we're quite limited as to what we can do surgically to a scar without giving you another scar.